we start our assessment, the first thing that we need to remember is that we need to do a survey on the outside of the room before we get inside the room. So our first survey on the outside of the room is making sure you have the room number in your patient as well as any signage. Now, I've given you examples here of potential signage that you might see on the outside of the room that is important to know, because you don't want to enter the room if your patient is on enteric precautions, so to speak. You want to make sure that you're well equipped before going in. There might be signage such as MPO status. So with that, you need to know going in that there shouldn't be any drinks or whatever within the room. This patient, however, is on a clear liquid diet for today. So this is C. Rivera. And so I'm going to knock, and then the general survey will begin. Okay, she says come in. All right, so as we enter the room, the first thing that we need to do is go ahead and start our general survey. So it's looking at the patient as a whole to see, is there anything that stands out? What I do see is I see that she's got IV fluids. It looks like sodium chloride at 100 milliliters per hour. And I'm going to want to check and make sure that that is what she is ordered for. So I'm going to also follow this to check the line, making sure that it goes into the patient. I'm looking and observing that the IV site looks good. I also see that she has a drain here. So in this initial encounter general survey, I'm just looking at everything. Lines, tubes, and the patient herself. She's sitting upright. She looks like she's breathing comfortably. She does have oxygen on her nose. So that's another thing that I'm going to be observing as I go through. As I walk around going to wash my hands, I see that she's got a Foley catheter, clear yellow urine, and I can observe the oxygen tubing going to the O2 meter and making sure that it's all hooked up. So I'm gathering all this information as I enter the room. The next thing that we're going to talk about is your WIAPA, which is the process that we do with every simulation, and you need to be doing it in the clinical as well. And that is WIAPA. So it's wash your hands, identify yourself, identify the patient. So, good morning, Ms. Rivera. My name is Lynn Modlin. I'm going to be here taking care of you today.
Good morning.
So, the next thing I'm going to ask is, what is your name and your date of birth?
Cassandra Rivera. My date of birth is August 18, 1958.
Okay, so I checked this, verify it, and then I can ask her, what allergies do you have, Ms. Rivera?
I'm allergic to shellfish.
Okay, does that do anything to you? What is your reaction to that?
I break out in rash. They called it hives.
Hives, okay. So now I've done the WIIA, so P is the plan. So what is the plan for today? So Ms. Rivera, I see that you had surgery this morning, and our plan is to get you up and ambulate you today. I'm going to do an assessment this morning, and then we'll work on getting you up and ambulating you. The next thing I need to do is probably a set of vital signs. Vital signs, getting a good baseline is important. Although it's not part of your general survey, it's something that we can do while we're doing our general survey. So, Ms. Rivera, I'm going to go ahead and get a set of vital signs on you. I'll get a blood pressure, pulse, and respirations. Okay, I've got 130 over 80.
That's about what it usually is.
Okay, and if you notice, I've kind of worked on both sides of the patient and in communicating her on both sides, so that kind of helps me know her hearing as I'm working. So I know that she can answer me on the other side. Her hearing was pretty good, and she's answering me on this side as well. So I'm going to get your pulse. Okay. And respirations. Okay, so we've got 130/80, we've got a pulse of 80, we've got a respiratory rate of 20, and we've got a SAT of 98%. And it looks like she is on O2 at 2 liters. So I'm trailing the tube, it's plugged in, I'm checking the dial, so we're good. So I pretty much got her vital signs. I'm still doing like a skin assessment just from what I can see on the outside. But I'm going to do more of a skin assessment as I progress through her assessment head to toe. So the fifth vital sign is pain, and this is something that you need to include in your assessment in your initial encounter. So Ms. Rivera, are you having any pain this morning?
A little.
Okay, can you describe it to me? Is it sharp? Is it dull? Is it stabbing?
It's just kind of dull in my lower abdomen.
Okay, where you had surgery on this side?
Yes.
Okay, does it come and go or is it pretty constant?
It's pretty constant, but sometimes it's worse, like if I move around.
Okay, so movement makes it worse. What makes it better?
Not moving, and the Dilaudid I got.
Okay, do you remember when you last got that Dilaudid?
Well, I'd say maybe 30 minutes ago.
Okay, so what's your pain on a scale of 0 to 10, with 10 being the worst pain and 0 being no pain?
I'm a 4 right now.
Okay, and what is your acceptable goal? Where do you want to kind of be?
I think, I mean, I can tolerate this, so I'd say a 3 or a 4.
Okay, 3 or 4. Well, that sounds pretty good. So what we've done is we've gotten our vital signs, we've gotten our general survey. The last thing you need to remember before we start our assessment is let's go ahead and establish a goal for our patient. This is something we do in the hospital, establish goals with our patients with our initial encounter. So our goal today, Ms. Rivera, would be to keep your pain level at a 3 or 4, since that's your acceptable level. So I want you to let us know when you're starting to feel pain that it's going to be unbearable so we can give you your medication as needed. The other goal that we need to establish today is to make sure that we get up and ambulate. It's real important after surgery to get up and walk, so I will ambulate you soon after we get your assessment done. Okay, is that good for you?
Yeah, I'll try.
Okay, any questions before we get started with your assessment?
No.
Okay, thank you.